It's 9:16. Welcome back to Fox 59 this morning. Recently, the American Heart Association found a link between melatonin and heart issues. So what does that mean? Dr. Kudo and Akute with Dreamland Health and Wellness joins me this morning with more. First of all, doctor, appreciate you being here. Really nice to have you this morning. So let's talk about what melatonin is and is not.
Good. So that's a great question. So melatonin is a hormone in the body, right? And right now is, in America as a supplement. It's not like a prescription medication. And so this hormone actually is produced by the body, and it helps us to regulate our circadian rhythm.
What is the observational study the American Heart Association did, and what did it show?
Yes, so this was presented last year at the American Heart Association research meeting, an observational study where they took about 130 adults with chronic insomnia who had been on melatonin for about a year. And so they looked at them over 5 years, and they found that they had a 90% risk of being diagnosed with heart failure when they compared them to adults who were not taking melatonin. Now, the important thing about this is that this is not saying that melatonin causes heart failure.
Okay.
They just found this association. But this poses questions and concerns about the safety profile of long-term use of melatonin.
Well, a link does not mean proof, though, does
Yes,
it?
it does not at this point. We need more research on this to figure out if it's safe to use melatonin long-term over a year.
Well, here's the other question. Does that mean should people stop using it? Because, a lot of people, that's how they sleep.
Yes, good question. So the first thing to know is that people that have insomnia should not resort to medication as the first line. The main treatment for insomnia is what we call cognitive behavioral therapy for insomnia, CBTI for short. That's the first line as per the American Academy of Sleep Medicine. Now, medications are second line, and so melatonin can be used short term while working with a provider on CBTI.
When people are trying to sleep,
Yes.
environment is also important as well to get some good sleep. What's your take on how much sleep people should get?
Yes, so the American Academy of Sleep Medicine recommends 7 to 9 hours of sleep. So anything within that range is fine. Some people are good with 7, some people will need close to 9 hours of sleep.
All right, Dr. Kudo and Akute, thank you so much for being here this morning. Appreciate you giving us the important details we need to know about getting the perfect sleep. We'll have details on the American Heart Association study over on our website. That's fox59.com.